in dental school, it was a lot packed into 4 years to produce a competent dentist. Whereas I felt in med school, it gave students a little bit more of an opportunity to explore what they wanted. Not to say that it was any easier, but I think it was a little bit more forgiving in terms of what you have the opportunity to, explore.
Hello, everyone. I am very excited because we have a wonderful guest today, Dr. Justin Middleton. I'm just going to give you an opportunity to tell us a little bit about yourself and your journey to medicine.
Yes. Well, thank you for having me today. I'm super excited to chat with you as well as all of the students. So a little bit about me and my journey through dentistry and now medicine. I did undergrad at the University of Albany, studied biology. Then I went on and did dental school at Boston University. And while there, I got involved in the oral surgery department. I, assisted, I shadowed, and, determined that that was the specialty within dentistry that interested me and what I wanted to pursue for a career. So I, went through the application process, and there's a match process just like medicine. And I matched into the 6-year oral and maxillofacial surgery program at Boston University. And what that entails is about 2 years of an accelerated med school program, and then followed by a 4-year oral surgery program. So I am currently I'm 4 months away from finishing up the medical school requirements. In about September, I'll be transitioning full-time into my oral surgery training. So yeah, that's a little bit about my journey so far.
That's awesome. My question for you is, since you are already a dentist, you completed dentistry training, and now you're doing an accelerated medical school training, what do you see as the biggest difference or the gaps, quote unquote, that they're trying to fill with you doing that?
Yeah, I think, so do you mean the biggest differences between dentistry training and medical training?
Yes.
So I think the biggest difference that I picked up on was with dental school training. I feel that the goal of the programs is to produce a dentist that has the opportunity to immediately go into practice, because you don't have to do a residency. In many states, you can graduate your training after 4 years and go find a job and work. Whereas in medicine, if you want to practice medicine, from my understanding, you have to do a residency. So I felt that in dental school, it was a lot packed into 4 years to produce a competent dentist. Whereas I felt in med school, it gave students a little bit more of an opportunity to explore what they wanted. Not to say that it was any easier, but I think it was a little bit more forgiving in terms of what you have the opportunity to, explore. Because 4 years is not a lot of time. But I definitely felt during dental school, I didn't have much time to just sit back and think okay, what do I want to do? And again, this is not to say in med school you have a lot of time to do that, but I just felt like in med school, I feel like the students might have a little bit more time to do that.
I think that makes a lot of sense, because honestly, there are some discussions floating around, do we even need 4-year medical schools because it's so expensive? Mm-hmm. And honestly, the 4th year is usually kind of a year full of electives and things. So I think you hit the head right on the nail. So I think that'll be very interesting for students who may be trying to decide if they want to go into dentistry, the pre-med versus medical school, or doing both like you did. So talking about doing both, what is a typical day in the life like for someone who is OMFS?
Yeah, so typically, so one, I haven't started the training yet, but I have a very good idea of what goes on. So typically your first year is, they consider it your intern year for oral surgery. And that typically involves, waking up each day, going to the hospital, if you're not on call, learning about the patients from, the previous days. And then you have patients to see. So if patients are coming in for extractions or biopsies or bone grafts, you have a whole list of patients that are essentially yours and your team's that you see. In addition to you holding a pager, and if patients come into the emergency department, you're the first line. You go in as the intern and triage these patients and, report back to your seniors. So that's typically like an intern day in the life. You do some other things with like planning cases for orthodontic surgery, which is like jaw corrective surgery. So you help with the planning. You do a lot of work with like getting patients optimized for the cancer treatment. So if patients have cancer in their jaw or mouth, there's a lot of work that goes on behind the scenes, getting them, optimized for treatment. So you're contacting their PCPs. So that's, pretty much what like an intern does. And then year 2 is typically off service. So you spend pretty much, at least I will spend about 10 months acting as a intern on the general surgery service. So you spend 10 months with them, and then you spend about 5 months doing anesthesia. So you do some pediatric anesthesia and you do some, adult anesthesia. And then years 3 and 4, you go back on service for oral surgery, and you're pretty much, functioning as the seniors and chiefs, and you're pretty much doing the bigger cases with the attendings. So, for orthodontic surgery, it's usually the attending on one side of the patient, you on the other side of the patient, and, you're working on their jaws. So the attending does one side, you do the other side. And that's pretty much, broad stroke of what oral surgery training is.
That sounds really intense for someone who's a family medicine doctor. Honestly, surgery wasn't my thing, but we need everyone in all of the fields to kind of help things go out. So for students who may have that passion entering the field, what advice do you have for them, especially people who are interested in going your route and doing both dentistry and surgery versus those who may be pre-meds and on the fence about going into either dentistry school or medical school? I know that's a pretty large question, but we have a lot of students out there who may be in that contemplative phase before they take either the MCAT or the DAT, or they're already in school and trying to figure out if they want to go straight into practice or do something else.
Yeah, it's a good question. Yeah, it's a big question. So I would say one of the things that's important to do is kind of sit down and try to envision what you value in your life. I think trying to have an idea of, what fulfills you, what you enjoy. Like I like working with my hands. So that's, one of the reasons that drove me to dentistry. I like the aspect of one of the things that I noticed difference between dentistry and medicine is when someone comes into the dental office, they're usually in some pain. And I found it very, rewarding where, they come in with some concern and you can immediately, fix that for them. And, they leave your office very happy. And, you can do that in medicine as well. But I found that it's over time where you get to a patient to where, their health is, optimized. And, I find that interesting, but it's not the most interesting for me. So I think it's important to just figure out, what you like and what you think you don't like or what you think you like. And then just kind of go for it. And there's nothing wrong with, saying like, okay, maybe this is not for me, and just changing paths. So I would say just starting from there of like, okay, do I want to use my hands more? Do I want to do more of a surgery? Or do I enjoy that aspect of, working in a hospital or working in an outpatient ambulatory clinic for, medical patients? I think that's kind of where I would start. And then I think one important thing is just asking people questions, because I'm of the belief, like, it's impossible to get through life by yourself. You need to utilize, resources and people that you have. So, there's been countless people that have reached out to me that, asked my opinion. And there's been countless people where I have asked, like, hey, what are your thoughts on X, Y, or Z? And, you don't have to take, their word, like, okay, this is what I have to do. But I think if you get a bunch of different opinions and then you triangulate all those opinions, I think you can come up with a good, tentative plan for yourself.
Absolutely.
Yeah. So that's
I
kind
couldn't agree more.
Yeah.
I couldn't agree more. I feel like life is a journey, and like you said, it's okay if you think you want to go through one path and then you realize that it's not for you. Like, you can always change and shift gears. And then also finding these mentors and these people that you can ask questions is so important, because most of the time, number one, people love to talk about themselves. So never be afraid to ask a question or reach out to someone, even if you don't know them, because either they'll say yes and tell you a lot, or they may not honestly have time and they can direct you to someone else who may be able to help you. So it's always okay to reach out, and then kind of taking those things and kind of figuring out what you want to pull from each person, because every person has their own experience. So that's why the listeners are probably tired of me saying this, but that's why I strongly believe in your personal board of directors, because you can't go to everybody for everything. So you may go to your mom for something, you may go to your mentor in school for something, your administrator, your senior, and everyone may tell you a little bit of something different or have that separate area of expertise. So it's great to kind of diversify that little board for yourself.
So true. So true. Your team is super, super important. Yeah.
Absolutely. So I definitely love all of the words of wisdom that you've shared with our audience. I'm going to ask you a question that I love asking all of our guests, because the answers are so diverse. So what is one thing that you would change about the healthcare system, knowing that it's so perfect, if you had a magic wand?
That's a really good question, because there's just like so many things that, I wish could be changed. I would say just a very broad stroke, like looking at how, I guess, the world has been working and how healthcare integrates into that world. I feel that like capitalism in the United States has not benefited the majority of people in the United States. And, one, I guess, downstream effect of that, it goes into healthcare. And one of the interesting things that I see is like in medicine, one of the, I guess, recommendations we have is like the DASH diet, for example. And, with the DASH diet, we're recommending fruits, vegetables, healthy foods to help lower people's blood pressure. And this is from personal experience. Paying attention to how much food costs is, it's a lot. And, you being in Boston, I don't know if you know where like Tropical Foods is, for example. It's near like Melnia Cass Boulevard. And then there's another grocery store towards Chinatown. And I go to both grocery stores regularly. And one grocery store towards Chinatown, the demographics, the people there are in a more affluent socioeconomic status versus where Tropical Foods is. I live right across the street from Tropical Foods. I go there every day. And the food there is more expensive, with, in a area where they have people that don't make as much money. So I find there's a huge disconnect in terms of like what we are doing to help the majority of people that have not benefited from capitalism. I don't have the answers for it, but I find it very interesting that, the policymakers are, saying one thing, saying they're trying to help these people, but it doesn't really seem like it's really helping. And we see that, Elon Musk is worth near $200 billion. The majority of the wealth has gone to a few people, whereas the majority of people have not seen their income raise. So I think if I could change anything, it would be healthcare, the healthcare system, working hard and, fighting with, policymakers to, advocate for our patients, because the majority of people don't have the means to get basic necessities, healthy food. One of the things that I've noticed was, living off of student loans since the beginning of dental school. Pretty much it's about $30,000 a year we are allocated towards living expenses. Living in Boston, Massachusetts, $30,000 does not get you very far. And, I'm very grateful. One of the opportunities that arose through COVID was students were allowed to get financial assistance for food. I'm one of those people that gets financial assistance for food because we have no income. And like I said, $30,000 does not get you very far. I'm lucky enough to be in a position where I know in a few months that next student loan reimbursement comes in where I'm able to get more funds. But there are many, many more people out there that don't have those resources and don't have that security that, can't get healthy food. So how can we expect people that can't get healthy food to, improve their health? So I guess just broad stroke is we need to look at capitalism and how it's been working and how it's been not working for the majority of people in the United States.
We can have an hour-long conversation on this. I couldn't agree on it more. You're speaking my language. I'll say a few things about it. Number one, students who may be listening, the student loan burden is real. I'm a hefty ways out of medical school, and it's still there. So it's something that's going to be there for me for a little while. And what Justin hit on is that there are a lot of things that are expensive. So that's one thing you can look at when you're deciding what schools to go to. And I wouldn't make that your only factor because with certain schools, there are other opportunities that come from going to those schools afterwards. But I definitely remember friends mapping out where the free lunches were every day because they just ate off of those. And then you have to go to the stores and get oodles and noodles and things like that because there isn't a lot of money and you have this huge burden and the cost of living is so high in a lot of cities. So that's one thing to definitely consider. In terms of the food is medicine, the capitalism, it all kind of goes down to those and correlates with those social determinants of health. So one, food insecurity is huge. Economic stability is huge. That kind of goes to who are the students who mostly need the student loan debt and get that is mostly students who are coming from underserved communities. And even if you're not, going through college and then going through medical school or dental school is very expensive and most people are going to need to take out some kind of loan. But in the food aspect, we see that most people who are in underserved areas do have less opportunities to get healthy foods. One, they're mostly corner stores or stores that are very expensive where you have to choose between being able to afford your medicine versus being able to afford something to eat. And when you choose those things, when you go and you are okay, let me get a fruit tray, let me get some watermelon, one of those is about $5 where you can get some chips and you can get fruit snacks, all of these other things that aren't necessarily giving you nutritional value for cheaper. They have foods that they're selling at the dollar store now that are full of preservatives and that are not healthy. Whereas if you go to Whole Foods or we have Wegmans here, there are a lot of different options, but they're much more expensive. And the most of the people who can afford them aren't people who kind of need them at this point because they have all of these healthcare conditions and things that are ailing them like hypertension and diabetes. And it's this kind of circle of life where If you can eat the healthier foods, you can get healthier, but you can't afford the healthier foods, so you continue to get sicker. And the world goes round and round and round. So we all need to come together and address these. I do have an organization called the Pacemakers that's working to kind of educate and advocate. Like you said, advocacy is important, and we do need to reach out to our lawmakers and make sure that we hold them accountable and help them come into the communities and make them better, as well as figuring out how we can work with other organizations to bring in things like food is medicine, bringing in things where you can get stuff delivered, you can get stuff where you can have meal tickets. I know when I used to live in Boston, they had the community health centers where you could get food tickets to go to the farmer's market and exchange that and say, hey, I have hypertension. Can you give me this fruit at a discount because I need it to live, just like you need the other things to live. So my rant is over because I know it took about 10 minutes to say all of that. But you are speaking my language, long story short. So here we are.
Yeah, no, I completely agree with you. And, I think many people do agree with us. But, I think just time, it takes time for these changes to occur. And, I'm optimistic that we will move towards, providing for the people that need it most.
Absolutely. I think that there are so many organizations popping up, and there are so many people who are being educated about these things and how they're connected, that we have no choice but to make a change. So I really appreciate you coming and taking the time to speak with us today. As you stated, it's definitely okay to reach out to us and let us know what questions you have or what you're going through. So I just want to give you the opportunity to tell the students goodbye and let them know how they can reach out to you.
Absolutely. Thank you for having me. This was an awesome talk. I greatly appreciate you having me. And for the students, I'll leave my email. It is JA Middleton 587@gmail.com. You can reach out with any questions, and I will write back. I usually like many people have done this before. I like phone conversations because I find that people don't really get the true, they don't hear your voice. I think when someone hears your voice, I think it sticks better. So I'll usually just say, hey, what time works best for you? If you want to have a phone conversation, we'll have a phone conversation. So yeah, reach out, and best of luck to everyone.
Thank you for coming, and for all of the students listening, please let us know and reach out with any future guests or topics that you want to cover. You can reach out to me on Dr. D. Graham, DOCTOR, the letter D, GRAM on Instagram, or on Med School Coach at Instagram. So let us know what you want to hear. Subscribe, leave those reviews, all of those fun things, and we'll see you again next week. Bye.
Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.